For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon to everyone. Thank you, as always, for joining us. I am privileged, as always, to be with you to share a little bit about what's happening with COVID across the state. And I think you have been tracking, as the governor mentioned, I would be using my Zoom this week to update you on our tier system, our blueprint, and then also to really dig into the science and the data about what's happening across California, how we got here, and really what the path forward is to make sure that we keep our public health in mind, we support one another, and we come together as we have before. So, as always, just want to begin and give you a bit of the national context. Sadly, we have day over day broken new milestones, whether it's in cases, hospitalizations, or sadly deaths across the nation. The Midwest in particular has been heavily hit, but really no region of of the nation has been spared. That the wave of cases that have been happening over weeks now have turned into record high hospitalizations and intensive care unit stays, that a number of states are making difficult decisions about how to allocate care. And even though we have the hope of vaccine and the discussions about what lies ahead on that front, we have to take care of the urgency of the day. And in California, as we've enjoyed lower rates of transmission, lower numbers of cases, we too are seeing this surge growing faster and faster, and we must address it immediately. So today's numbers, although not our highest number ever, frankly, on this sort of surge that we've been dealing with, this is our highest number to date. 11,478 COVID cases reported, widespread across the state, moving our 7-day average to 9,665. This is in the face of, frankly, what is a lower than recent numbers of tests reported. We had been reporting upwards of 200,000 tests across the state. This is in the face of lab efforts built by the state. We talked to you about our partnership with Perkin-Elmer, but really so many different health systems, so many different laboratory partners have really stepped up in California to provide lab testing and COVID testing so we can be informed about diagnosis, track the disease, and put our contact tracing and efforts around supporting isolation when necessary and quarantine at other times so that we can stem the tide. The governor often focuses on test positivity, accurately so. We have seen this number come up from what had been below 3% just weeks ago to now a 14-day positivity of 5% and a 7-day positivity concerning up to 5.6%. We have a goal to keep this as low as possible, to continue to test our communities, to find cases, to wrap around those cases, avoid one case becoming many. But this number is one of caution and one that intensifies our resolve to get it back under control. If you take a closer look at this 7-day positive, 14-day positivity, we knew just a couple weeks ago we were at 3.3%. We were talking to you then about how it's climbing and it's rising, and it certainly has a nearly 52% increase just over the past 2 weeks. I know the numbers, it feels like, it's just a small difference between 3.3 to 5, but it's a very significant difference in the percentage increase, which is when we focus on not just increases in rates, but this notion of rate of rise in 2 weeks to have a 52% increase is quite concerning to us across the state. Hospitals, we talk to you about hospitals all the time, that we know that 12% of today's cases will be hospitalized in 2 to 3 weeks. That helps put these numbers in context. We've seen a 63.6% increase in hospitalizations for COVID-19 over the past 14 days. Just days ago, reporting that we were just climbing over 3,000 cases in the hospital across the state. Today, over 4,500 Our ICU capacity, one of our most precious resources, that signifies not just the bed in a specialized unit, but specialized staff trained to use the equipment and take care of very sick individuals, and ventilators and all the medications and tools that help us support one's respiratory system. Those beds have seen an increase of 40.5% over the last 14 days and have climbed to just over 1,100 individuals in those beds. Just a reminder that if we look day over day, week over week, we've seen a climb, not just in the number of individuals who are hospitalized, but really in the number of new admissions coming through the front doors of emergency rooms and hospitals across the state, something that is concerning. So even though that number slowly rises on hospitals, much faster are the number of new admissions, because what I said earlier, a reminder, roughly 12% of those individuals, those cases today that test positive, we expect will be in our hospitals in 2 to 3 weeks. So we've talked about not just the rise, but the steep rise, that rate of rise. You look at what we experienced during that first significant surge early on in the middle of the summer in June and July. We had a peak rate of increase of about 39.2% over a 7-day period. Again, here we're over 50% in the same 7-day period. This doesn't necessarily tell us where we'll end. Some states across the nation have seen this double in just a week. We know that we are still increasing that rate, and we aren't sure where the peak will be. So that is why we certainly need to be laser focused on all things we can do collectively across the state. Just take a look at a couple of important counties. We have 58 in California. We chose 2. Los Angeles County, we're often talking about how Los Angeles County really does drive transmission across the state. We see them a very important populous county, just at the beginning of the month, reporting 1,500 cases a day. A few days, a week before that, they were hovering about 1,000, 1,100. Today, 147% increase since then at 3,742 cases. And certainly all signs point to continued rise in that number and potentially even higher numbers than this report today. Madera County, sure, smaller county versus LA, geographically separated, but still 6 cases on November 1. Today reporting 34 cases. You may say, well, that's still a small number, but that rate of increase, 460% over a small 2.5-week period, is an important message to all of us that this can go very quickly. The support from Madera County is important. All counties getting the support that they need so that we can curb this transmission and ensure that our hospitals are prepared for those who need it the most. So what has caused the rise to go so high and so fast? And I'm often asked this question. I've been asked on Zooms and press conferences before, well, you say it is this, but where's the evidence? You say it's that. And we do have plenty of data and evidence around certain sectors. But overall, I will say that there is no single culprit. It's a combination of factors. It's certainly the colder weather, more mixing, which comes with more opening, not just of places indoors and places where you can mask, but places that are indoors that don't have an easy time masking the whole time. And of course, greater travel. We've enjoyed some events over the last many weeks in my home county of Los Angeles, the Dodgers, the Lakers. We had Halloween. We just exited Veterans Day. We're looking forward to other future events and activities as we go into the winter. We've had some things to celebrate, some things to protest, coming together in ways that we don't usually always do. All of those things create opportunities for the virus to spread, opportunities where when we put our guard down, it certainly does spread. And we know that those are factors driving this high transmission. So what does it mean when levels are this high across the state? Really means that activities that you normally do are higher risk today than they were a month ago. We've seen reports of people saying, well, I haven't changed my behavior. I was doing the same thing a month ago. Well, today, because the background transmission rate, the level of COVID in our communities is higher, even our everyday activities become higher risk. And we must be resolved to put up our protective guards even more than we usually do. And so today's collective actions that I'll be discussing in just a minute target activities that are particularly high risk while minimizing the disruptions and the social connections we all need and desire. So our ability to be more targeted and thoughtful is an important part of our overall message and approach. So a reminder, I've used this slide many times before about what some of those high-risk activities are. We said and talked about the need to mask, and not just mask for part of the time, but the whole time. We know that when you're eating and drinking, the mask comes off. We ask you to keep it off as short a time as possible, to put it back on when you're done eating, when you're done drinking, even if you're getting together 6 feet apart from friends and others you haven't seen outdoors, that keeping that mask on is an important strategy to reduce risk. Activities when you're seeing people that you haven't seen in quite some time, people outside of your household. This includes close family members, friends who haven't been with you in some time, that just because you know them well on a personal level doesn't necessarily mean that they in any way wouldn't be able to transmit the virus to you or you to them. Activities where it's difficult to keep your distance. I often think about playing board games and card games with my kids on the carpet of our living room, or employees in a break room. We've heard about outbreaks at hospitals, not in a patient's room, not the ICU or emergency room. Certainly that happens too, but often when staff take their guard down, they think it's a moment of rest, and yes, we all need it, especially under these difficult conditions, but that isn't a time to take off your mask, enjoy your meal. It's time to keep it up and make sure we do what we can to prevent the spread. Activities that are longer duration, we know that the longer your potential exposure is, the more likely you are to either be infected or spread the infection to someone else. And activities that don't allow plenty of fresh air to circulate. We've learned a lot in the past couple of months. Probably one of the most important areas of development with COVID is our understanding of the criticality of ventilation. Getting fresh air into rooms is really key. Having that air circulate frequently over the course of time, each hour, many air circulations, as many as we can achieve, really do reduce the risk. And those settings where that's not possible are indeed high risk for all of us. As I was trying to explain this to my own mother here in California, I was thinking about a simple way and almost an equation to understand how we can calculate your risk for COVID, and really came up with this in that discussion, that your chance of being infected is sort of this simple equation. On the top, the likelihood of an exposure, as that goes up because there's more baseline background virus in our communities, that you're in a situation, the duration of exposure going up, that's sort of complementing, they're additive. As that goes up, our chance of getting infected certainly goes up, but it's always divided by or reduced by the level of protection that we have, our ability to keep our mask on, our own personal discipline to keep that mask on, not just when you're with those who you're not familiar with, but sometimes especially those when you're with those who you're familiar with. We know more and more the role of household transmission. What I mean by that isn't when you're gathering with people in your house. It's actually when you maybe return from work or school and you are been mixing with folks where you might have been infected, that being able to protect especially those vulnerable people in your home by wearing your mask, an important issue. And then, of course, keeping that separation, that physical distance of at least 6 feet helps reduce this overall risk. So something that was effective with my own mom, wanted to share it with you today as you think about how we are in the situation that we're in California, that certainly that increased exposure is key. Our urging to limit your exposure helps reduce that overall risk, but then really amping up and elevating our level of protection through the protective factors and different interventions we've been talking about, both the governor and I, local public health, national public health leaders for many, many months now. So to the announcement today of what we'll be doing in the state of California, we are going to, just as we did back in March, we started with a full stay-at-home order. It was very effective. Californians came together. We were able to stay ahead of our curve and keep transmission low. Today, in a more focused way, based on many things that we've learned over the past many months, I'll go over those things in just a moment. We are putting forward a limited stay-at-home order, one that is more targeted, one that is more focused in the following ways. It impacts counties that are in the purple tier. You'll remember on Monday, we announced 41 counties across California are in the purple tier. Today, we are not announcing additional counties in the purple tier. In fact, over the past 48 hours, if we looked at the data, no county across California has moved to a more restrictive tier, and certainly no one has moved to a less restrictive tier. We're asking that as part of this targeted, limited stay-at-home order, that people are home by 10 and stay home until 5 a.m. This means that many essential businesses that we've in the past called non-essential businesses, there's a list of what's included and not included in that category, that we ask that they close operations by 10 p.m., that people can get home by then, and that they stay home, and those businesses don't resume operations till at least 5 a.m. throughout all of the purple counties. This order, this public health order that will be modified at the state level, will be effective November 21st, so that's Saturday night at 10 p.m., and will go until December 21st at 5 a.m. So what does this mean practically? I'm sure many are asking what this means. I just wanted to highlight a few things at the top. I know I'll get many questions on this and look forward to answering those. But what does it mean that you can still do? So I think about my own life and often the need with 4 young kids to make a late grocery store run to make sure we're stocked for breakfast in the morning or a meal. And yes, it does mean that I could still go to the grocery store at 11 if that grocery store is still open to pick up milk or eggs or whatever I need. My dog doesn't walk very well, hard to get around the block. But yes, I can walk my dog at 11 p.m. if that's your tradition and routine. And for restaurants that close their front door at 10, doesn't mean that the back door to do takeout and delivery is closed. And so we urge people in a limited way to use restaurants in that way. And for all you restaurant operators and owners, that's certainly an opportunity to keep some amount of business going. And why are we doing this and what are we hoping to gain? It's really to avoid further restrictions. We know, and we've seen in the past, that COVID goes from 0 to 60 miles per hour very quickly. That we're in a place today, but that can rapidly change. Maybe not statewide, maybe just in a handful of counties, but further restrictions is what we hope to avoid. But all tools are on the table. We have sort of that top shelf of the toolbox. We continue to use those tools, but on that bottom shelf, if necessary, we will explore further restrictions. But we hope today's actions, our collective coming together, our resolve to keep our protective behaviors up, will help us stem the tide and bring these surging numbers down very, very soon. Again, some reminders of why we're doing this today. Why now? Well, we want to keep the highest risk individuals safe. We know that although many people who might be out and about, even between 10 and 5 are not the most vulnerable, not our oldest Californians, not those with underlying chronic conditions. That said, we know that those who are out, who might be engaging in higher risk behaviors, that those infections can quickly spread to other settings. Maybe you're a worker who's out at night with a group of friends, outdoors even, and you contract COVID, and then you go the next day to work and it is passed on, maybe not the next day, but a day or two later, to a vulnerable resident in a congregate care facility. Exactly the situation we want to avoid. We've learned very clearly that it's not just about our own personal COVID risk, but it's about the risk that we infer on others around us because of our choices and behaviors and actions. This is, of course, to keep essential workers safe as well. Those who continue to pick our food, sell our food, prepare our food, and many other essential workers across the state, allowing them to come to work with confidence and safety, part of the reason why we do this today. We continue and haven't over the last week or two, but it's always front of my mind, the disproportionate impact of COVID. And as we see cases surge, that disproportionate impact still holds. We will see brown and Black communities across our state disproportionately impacted, more Latinos, more African Americans, more of our Asian neighbors infected because of some of those conditions of work and other situations. And we want to make sure we do all we can to support and protect those populations. And frankly, this is going to help us stop the surge faster and avoid more severe actions and restrictions, as we've talked about. And ever so important to remind you that our hospital capacity, although we did a tremendous job preparing and have those resources in place, some have been activated, many wait to be activated, but we want to make sure we protect that hospital capacity so those who need care get it and get it in a timely way and in a way that's high quality so they get all of the benefits that they can. So California, as we've reminded before, we were the first state to do a stay-at-home order. We saw its impact back in March, those difficult days adjusting to the reality of COVID, but that kept us ahead of the curve. While other states were experiencing high rates of rise and were working on flattening their curve and their transmission, we really didn't in March experience that radical rise. And just like then, today's actions will help us bring down transmission and flatten our curve, this time in a very important and urgent way. This graph, we haven't shared it in many months, but we showed you back in March that without an intervention, we see these rapid rises. And yes, it comes down, but after a really important toll on all of Californians, that without interventions, we see high case rates, high impact on our hospitals, but with interventions, with the things that we're emphasizing today, along with the many other actions that are already in place, that we can bring this curve down, we can flatten it, we can get it to a point where our healthcare system is able to do what it's intended to do, which is take care of the sick in a high quality and complete way. I wanted to remind people, because today I've already gotten questions, our own team talked about it. Why are you focused on the time period from 10 to 6? Why are we not doing what we did in March? As we have significant concern around surges. Well, we've learned a lot, and we've been a state that has been guided by data, guided by science, and in that data and in that science is a great amount of learning and refining our thinking, focusing on our interventions in a way that allows us to be more targeted and do things not in all tiers, not at statewide, not for 24 hours of every single day, but in more focused ways. And what are some of those lessons? It's that masks do protect us, not only those around you, but the evidence is clear that they protect you as well. Moving things outdoors significantly reduces the risk of exposure and transmission. We've mentioned it already here. We've mentioned it for many months. Move things outside, keeping it short. Both of those things helps us reduce transmission. The whole concept of ventilation, about bringing outdoor airs indoors, even in canopied areas outdoors, making sure that we have clear and easy ventilation is an important feature to reduce transmission. We've learned that squarely, not necessarily in March and April, but really over the past couple of months. The other very important thing, no one knew this early on, that even those who do not have symptoms and look perfectly well are spreading the virus. You've heard about asymptomatic spread. You've heard about people who are pre-symptomatic spreading the virus. This is a very important feature. Unusual feature of a virus makes it harder for us to manage and track. And part of the reasons why we must take early actions, we must take actions that even if the impact is seemingly invisible to some because folks aren't sick who they're around, this fact is a very critical one that pushes us to take these actions now. And then importantly, and this has really been an important guide to me and our team here, clarifying that roughly 12% of today's cases will be hospitalized in the next 2 to 3 weeks. Since early July, we've been tracking this, and although in some parts of the states it's as low as 6 or 7%, other parts it's closer to 15 to 20%. On average, 12% of our cases will be hospitalized in 2 to 3 weeks. What does that tell you? It helps you plan based on what you're dealing with today in hospitals, today's cases, what the next 2 to 3 weeks looks like. And that helps us make decisions now so we can avoid some of those big surges in the hospital beds and the potential for not having the capacity that we've depended on to date. So again, it's always important to emphasize what we can do to make a difference, to keep our schools open, to keep that economy operating as much as possible, and our healthcare system functioning. Talked about wearing that mask, wearing your mask, not just when it seems convenient or when it seems like you're around people you don't know, but as much as possible. We've updated our mask guidance, and we will update it again as we continue to evolve with the science and see opportunities to support additional masking across our state. Keeping your distance, spreading things out when you can, using the entirety of your backyard for a gathering, using multiple rooms when you're with someone else indoors, and spreading things out, I think, is really key to helping us reduce transmission. We've talked about the importance of circulation, keeping windows and doors open so outside air can come in and frequently is important. Keeping things short no matter where you're together with others, keeping it small. We've talked about our California standard that no more than 3 households. This includes your own household, so it's not 3 others, it's yourself and 2 others. Important. And now today, underlined here, bolded here, gatherings shouldn't occur between 10 p.m. and 5 a.m. We know that's hard to imagine how to enforce. Some of you may say, well, how am I ever going to be known if I'm doing that at home? We've depended on a partnership with all of you. This is about coming together. This is about us deciding to do some things that sure it's an inconvenience, sure we may not want to for a short period of time so we can get this under control and hopefully bring rates down to a place where counties don't just stay in purple, move to red, orange, and yellow down the road. And it's always important to end these actions with an eye towards protecting older Californians and those at risk. I'll take this opportunity to remind you that even though only about 10% of California's cases are in individuals over the age of 65, 75% of our deaths, that worst outcome that we want to prevent at all costs, is experienced in that age category. So no, I'm not going to give this presentation again in Spanish. I'm going to invite my friend and colleague, Dr. Gil Chavez, to share some of the same message here in Spanish. And then when he's done, come back to you, wrap it up, and take as many questions as we can from reporters. So thank you, and Dr. Chavez.
Muchas gracias, Dr. Ghaly, por siempre darnos la oportunidad de comunicar estos mensajes importantes con la comunidad latina. El día de hoy quería yo comenzar mi presentación con una revisión muy breve de lo que es y qué se considera como alto riesgo para una infección del COVID-19. Porque a final de cuentas, todas nuestras acciones deben estar dirigidas a reducir ese riesgo. Entre mejor sepamos cuáles son actividades de alto riesgo que hay que prevenir, lo mejor que estaremos. En primero y muy importantemente, las actividades en las que es difícil usar la mascarilla todo el tiempo se consideran actividades de alto riesgo y las debemos de limitar. Por ejemplo, comer y beber cuando estamos en un lugar público frente a otras personas conlleva mucho riesgo. Entonces, removernos la mascarilla brevemente y ponernos otra vez muy rápidamente. Actividades en que se reúne con personas que no ha visto recientemente, por ejemplo, personas fuera de su hogar, son actividades de mucho riesgo. Actividades en las que es difícil mantener la distancia, cuando vamos a estar muy congregados, muy encimados, todo eso conlleva mucho riesgo. Actividades que son de mayor duración, si voy a estar fuera de casa, voy a estar en un lugar donde hay mucha gente y la exposición, la duración de esa actividad es muy larga, eso aumenta mucho el riesgo. Y por último, actividades que no permiten que circule suficientemente el aire fresco. Entre mejor estemos expuestos a la ventilación, al aire fresco, mayor vamos a disminuir el riesgo de infección. Entre más estemos en lugares encerrados, en lugares donde no hay circulación del aire, vamos a tener un riesgo más elevado. Perdón. Muy bien. Ahora, siempre que pregunta la gente, me ha preguntado mi madre, me pregunta la familia, ¿qué es lo que da el riesgo de infección y cómo podemos prevenirlo? Hemos pensado en una fórmula matemática que es muy fácil de explicar, en que tienes por un lado lo que es el riesgo, la probabilidad de exposición y por otro el nivel de protección. Entonces, entre mayor tú tienes una probabilidad de exposición alta y lo multiplicas por un periodo de exposición muy larga, eso aumenta muchísimo el riesgo del COVID-19. Por otro lado, si tú vas a tener protección como es la mascarilla y como es mantener la distancia, eso te disminuye mucho el riesgo. Entonces, esto es un balance entre actividades que aumentan el riesgo y los niveles de protección. Por eso es muy importante que nos tratemos de minimizar las actividades de arriba, las que aumentan la exposición, y maximizar las actividades de abajo que nos aumentan el nivel de protección. Ahora, el día de hoy estamos aquí para revisar una orden que se ha dado por medio del Departamento de Salud Pública de California, que dicta que vamos y debemos permanecer en casa en los condados que están en nivel púrpura o morado. Entonces, repito, en condados donde estamos a nivel púrpura o morado, se dictamina que a partir de las 10 de la noche y hasta las 5 de la mañana debemos permanecer en casa. Y esta orden está en vigencia a partir del 21 de noviembre hasta el 21 de diciembre. Ahora, para explicar muy bien, ¿qué es lo que esto quiere decir en cuanto a nuestro nivel de vida de día a día? ¿Qué es lo que podemos seguir haciendo? Claramente podemos ir al supermercado a hacer compras en la noche si tenemos que hacerlo, ir a la tienda de abarrotes, ir a la farmacia, ir a caminar al perro. Y me voy a quitar esto porque está dando calor. Muy bien. Entonces, caminar al perro, comprar comida para llevar a algún restaurante. Todas son actividades que se permiten y se pueden seguir haciendo después de las 10 de la noche. Esto es importante mantenerlo y hacerlo porque eso nos va a evitar tener más restricciones más adelante. Ahora, ¿por qué es que estamos haciendo esta orden ahora? ¿Por qué exactamente ahora? Es muy importante reconocer que los niveles del COVID-19 han estado aumentando muy importantemente y eso le conlleva mucho riesgo a las personas mayores. Entonces, para mantener seguros a quienes tienen mayor riesgo, es muy importante que adoptemos esta orden. También para asegurarnos que vamos a proteger a los trabajadores esenciales, para disminuir la ola de incremento de los casos y evitar que tengamos que tomar medidas más agudas más tarde, y sobre todo para proteger la capacidad de nuestros hospitales, para que aquellos que necesitan atención puedan recibirla prontamente. A final de cuentas, nuestras actividades 100% están dirigidas a prevenir enfermedades graves y asegurarnos que hay acceso a la atención médica. Hay que recordar que California fue el primer estado en emitir una orden de permanecer en casa en marzo. Y con eso demostramos en marzo que nuestras acciones nos mantuvieron un paso adelante de la curva, mientras que otros estados que no lo hicieron tuvieron un incremento de casos muy importante. Entonces, en California, hemos demostrado que estas órdenes son muy importantes para reducir el riesgo de comunidad y de transmisión. Entonces, al igual que entonces la acción que tomamos hoy, pensamos que nos va a ayudar mucho a reducir las transmisiones y aplanar la curva de la enfermedad. Para revisar brevemente, hay algunas acciones que hemos dicho muchas veces y queremos repetir, que son muy importantes entre la diferencia entre mantenernos saludables y enfermarnos. Acciones que también nos van a permitir mantener nuestras escuelas abiertas, van a permitir que la economía funcione y que nuestro sistema de educación, de atención médica, siga plenamente y sin interrupciones. Las medidas que tenemos que tomar, como siempre lo hemos dicho, usar la mascarilla siempre, mantener la distancia. Si va a hacer una reunión, asegurarse que está la gente esparcida, que no está muy cerca uno de otros, mantener las ventanas abiertas y un aire fresco circulado, mantener las salidas, las oportunidades de exposición a niveles muy breves, mantener las reuniones en su casa a niveles pequeños, siempre acordarnos de no tener más de 3 hogares, incluyendo el hogar en donde nosotros vivimos, acordarnos que a partir del 21 de este mes, las reuniones no deben ocurrir entre las 10 de la noche y las 5 de la mañana, y sobre todo y muy importantemente, proteger a las personas de mayores edad y a los familiares en alto riesgo. Muchas gracias.
Thank you, Dr. Chavez. And as always, so important to have Dr. Chavez as part of our team, both his leadership here with nearly half of Californians, our Latino brothers and sisters across the state, but also his leadership on improving testing across the state, making sure that our own lab here with the state is doing what we expect it to do, and so many more. So with deep appreciation, thank you for joining me. So before we get to questions, together we can stop this surge. We've done it before. I know that the leadership here at the state, your local leaders and partners and public health officials and healthcare workers across this entire state know that we can do this. And today's actions are an important step, but not the only step. And as the rate of transmission gets stronger, I think we will too. And I look forward to watching how our actions help us flatten the curve, bring this surge down, protect our systems and our healthcare delivery system, but most of all, to support Californians to get through this difficult pandemic, to get through it, not just with our health, but with strong communities. And I believe that that's exactly what we will do. So with that, based on the information that I've shared, hope to take questions related to today's announcement and presentation from those who've called in from the press.
Phil Willen, Los Angeles Times.
Hi, Doctor. How you doing?
Great, Phil. How are you?
I'm doing pretty good, thanks. I have a couple questions. One is about enforcement. We've already had or seen some reaction about the new order that went out. The Sacramento Sheriff, Scott Jones, basically said he won't enforce it. And I just want to find out, how you kind of deal with that. Number two is I'm still kind of want some clarity on how it's going to affect businesses. I assume that even outside dining would be prohibited in the purple counties, same with at bars that serve food and places like that, if you can confirm that. And also, what about businesses that operate overnight? There are manufacturers that have night shifts and, warehouses, the same thing. How are they going to be affected?
Yeah, all good questions, Bill. Thanks for all three of them. So the first one, look, public health and public health orders have been thrust into the spotlight in a way this year that we never have. But where we always start in public health is in partnership, in communication, and education. And we believe today's actions, just like many others, the first step is a clear explanation for why we're doing it, how following it and supporting it across the counties, across the state will help us get this under control. So that's where we start. But we also have enforcement tool that for local jurisdictions and even at the state level, we're able to enforce it. And we hope that if that tool is necessary, that counties use it as appropriate. But we're really about pushing forward this public health message that we can do, and taking these steps will allow us to do what we can to reduce transmission. Specifically for restaurants and bars and other businesses that you asked, yes, the impact is that those non-essential business sectors, we have a list on the website. We'll be posting them with our sort of questions about this order, specifically describing which those are. They are requested to stop all operations, not just indoor operations, because frankly, in purple tier, there isn't indoor dining. There are not indoor bars and other entities open, but those outdoor services should also stop. That said, remember, takeout delivery still allowed during those other times. And then for those essential services, we call them essential infrastructure services, another set of entities listed on our web pages. You can find out which those are. If they have overnight shifts, because they're not part of this order, they can operate. People should be able to go to and from work, and we hope that people have no difficulty in change with that part of their life or their business.
Adam Beam, The Associated Press.
Thank you, Dr. Ghaly. You said that California is seeing record acceleration of the virus, and this is occurring under this tiered system that you and the governor have said is working as designed. So what makes you think that this change will flatten the curve? Is there scientific evidence that nighttime curfews like this one have proven effective in slowing the spread of COVID? And finally, Governor Newsom usually makes big announcements like this. Why isn't he doing it today?
Yeah, so the first part of your question, the blueprint has really helped us move in a slow and stringent way forward. We've used the emergency brake function because we always knew that, and as I say it, COVID can go from 0 to 60 very quickly, and it has. We've seen it across the nation that the baseline transmission rates, how much virus is in our community is higher than it was. And in those conditions, spread can be quick. Spread can happen with asymptomatic individuals. And we've seen the tools, as I identified earlier, those tools are available to us, and being focused and targeted in some of these activities that tend to happen in the nighttime hours in a way that still allows us to move around and do essential activities and certain things during the day, starting with this 10 to 5 period where often activities that might happen either in businesses like restaurants and bars, or even in homes or outdoors where, certainly people might be gathering with friends and maybe, taking their guard down a bit because of the activities that they're enjoying. Masks come down, maybe some additional activities that increase transmission. So a focused, targeted effort to really reduce those activities while still allowing some other things to occur because we're fatigued. The whole state mentions that this idea of COVID fatigue, COVID resentment is an important piece. So it's all looking at the various tools based on the lessons that we've learned over time and how we apply them. That said, we know that public health, we've been led by the science and the data the whole time. That's been what the governor says to all of you, and he demands of me and our entire state team. And in looking at that, if we do see trends that are more concerning, that we don't see the impact and effects of the actions today, there are other tools in the toolbox. We've used them before. We've developed others. They are additive and we will use them. As for the governor presenting today, certainly, at his guidance, I'm here talking about the data and science and making this really deeply sort of thoughtful announcement and moving forward to really, most importantly, get this surge under control and do what we can to save lives and reduce the level of illness in our counties and statewide.
Stephanie Elam, CNN.
Hi, Dr. Ghaly. I'm really interested in what you think may happen if people don't adhere to the guidelines that you're setting forth for Thanksgiving, and what we could see happen with those numbers, and especially looking at where our death rates could go with some of this. I guess, looking at the fraction of people that have gotten it, seems like there's a lot of people who are still susceptible to it. And just trying to get people to understand that the danger is still out there as far as Thanksgiving, and I guess at this point, the December holidays as well. Is that also part of what's factoring into your decision on pumping the brakes now? Thank you.
I will tell you that at this level of surge, no matter what's coming next week, we would make these actions. Certainly the fact that holidays and opportunities, traditions for coming together are right around the corner. And, some of the most joyous experiences of all of our lives come during these coming weeks. And the fact that they are those traditions where we get together makes them some of the highest risk settings. And if we don't follow some of the guidelines, all of the guidelines, that we don't make choices to limit our mixing, limit our risks, limit our cross-country, cross-state travel, we will see accelerated rates of transmission, and they will augment and exacerbate the situation we're in. I think one important data point that I'm shared it before, but emphasizing today, is 12% of our cases could end up in the hospital, have ended up in the hospital 2 to 3 weeks later. So if you see at 10,000 cases a day, today we're reporting over 11,000, that means in 2.5 weeks, 1,200 individuals could be hospitalized with COVID. You have that run, 10 days of 10,000 cases a day, you can see how that number adds up. So to your question, what could it mean? It could mean a serious challenge on our entire healthcare delivery system, and not just the beds in the buildings, but the staff. Your neighbors who are nurses and physicians and techs in hospitals helping run x-ray machines and work the emergency room, they are also at risk because of individual choices that we're talking about today. So I'll use your question to emphasize that in many ways, the days and weeks to come will be different than years past. And in order for us to have do the best we can with controlling this virus, we're going to have to keep our guard up, make some tough choices, make some decisions, even unpopular ones. If you are part of a gathering, a planned gathering today, and you feel that the news today and the situation in your own county, pick up the phone, call those you were going to gather with, and have a conversation and maybe make a different decision. I think it will pay off in the long run for all of us.
Lena Howland, KXTV. Lena Howland, KXTV. Jeremy
Hi there,
White.
thank you for taking my question. I'm wondering, why are some schools still able to have in-person learning, even though their counties are in the purple tier, and we also have this limited stay-at-home order? Will things change for those schools that are doing in-person learning?
Yeah, excellent question. Before this, I had the chance to talk to nearly 1,000, could have been over 1,000 of our education leaders about this question and many others about the impact of COVID on schools. And in that conversation, we emphasized the fact that the plan around cohorts, around really creating, mitigating opportunities to reduce transmission in schools, the idea that we have masking, that we have distancing, that we've done work to create important augmentations to ventilation, all of those things help reduce the risk. And then on top of that, being able to provide strong outbreak investigation, looking at cases, reporting them, working closely. Historically, local health jurisdictions, public health leaders at the local level work very closely with school districts. Having those protocols in place in red and yellow and orange and yellow tiers helped us formulate plans, create a body of evidence that we can keep in-person education going to a certain extent, even in the purple tier. So through wide, broad spread support of those schools, those faculty, teachers, those families and students, it is possible, and that's why they remain with that option.
Jeremy White, Politico.
Hey, Dr. Ghaly, thank you so much for talking to us. What would this mean for people staying over at other people's homes? Say, for example, if somebody from out of the household visits for Thanksgiving, would they have to go home before 10 p.m. or could they stay over?
I mean, look, the spirit of the order is that if people are visiting your house for a gathering that goes beyond 10, but they are expected to go home that night, we want it to end by 10. We want the mixing to be minimized. To your question, if there's an out-of-town guest and that's planned, and we talked about keeping it to 3 households or less, and they're staying in the guest suite or guest bedroom or on the couch in the living room, wherever it works out. Of course, we're not saying that has to be limited. That said, I think many Californians can relate to the important message and spirit of what's happening with this order, and we ask you to take it as seriously as you can, because every action is additive, every little bit counts. And when you look at 1,100 plus cases today, and that is going up, it's not coming down. And in July, we peaked just over 1,200 cases, but that was on the downward slope. We're still going up. That each of those actions and decisions can make a difference here. So hopefully that answers your question and gives our public and Californians a little bit more guidance on what this means.
Final question, Sophia Bolog, the Sacramento Bee.
Hey, Dr. Ghaly. So you had said that you anticipate that local governments might enforce this at a point when it becomes necessary. And I'm wondering if you can provide a little bit more clarity on what you think that would actually look like. What is the point at which you think local governments need to step in and start enforcing this order? And also, I'm wondering if you can clarify how this order applies to people who are traveling to and from non-essential activities. For example, if you went to dinner, you wrapped up dinner by 10, but you're driving home, would you technically be in violation of the curfew if you're not home from that non-essential activity before 10?
Thanks for the question, Sophia. So first off, I just want to point out, we because Californians are familiar with what is that stay-at-home order, this is a limited stay-at-home order. The language, words of curfew, something that we certainly here believe there's this is different. This is built upon a basis that people understand, a tool that's been effective in COVID in the past. So again, really emphasizing along this continuum of stay-at-home orders that this is a phase in that, and it's in a limited way applied to that purple tier, applied to a limited number of hours, and for a finite period of time over the next 30 days until December 21st. In terms of what is that threshold with enforcement, let me be clear, this is enforceable now. That in jurisdictions that may choose that this is the time to use it in that way, and it's a tool, we are, it's important for those jurisdictions to be able to use it now or Saturday when the order comes into effect, and to use it to the extent that they believe it helps them control these activities that could add to the transmission. I don't have a level of threshold county by county, but I certainly can imagine that some counties will benefit from using this as a tool immediately, given the high rates of transmission, not just hovering around the threshold between red and purple, but well above purple. Certain parts of our state have experienced that quite quickly over the past many weeks. And then to the last part of your question, what about that person who wrapped up dinner at 9:45 and has a 30-minute commute home? Hopefully they're doing it in a safe way. They go straight to their home, and that, within the reasons of this order, like all public health orders, that people take it seriously first and foremost and get home as soon as possible after that 10 o'clock time. So we hope, certainly didn't intend this to have stories of people being pulled over or in some ways targeted at 10 or 10:25 or whatever time. This is really meant to help us have another tool, another reminder, another action to take to contribute to us coming together as a state and controlling this pandemic and getting us back from purple to less restrictive tiers across the state. So again, appreciate all of your patience. You're sitting through a number of really important questions. Thank you to the reporters for providing me a chance to clarify details. I know there'll be more questions. We are always happy to provide that clarification. We will continue to be watching the data closely, not just statewide. As the governor says, we don't live in the aggregate. We know that county by county, you have experiences. We're watching that closely. We're working with public health and local officials, not just on the implementation of this new action today, but on the need for future actions if that time comes. We will be guided by the data and the science. We will continue to come together, and together we can get to a safer and better place soon. So with that, thank you very much and have a good rest of your afternoon.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.